Hello, this video will explain what is a cataract, what to expect in cataract surgery, and a guide to picking a lens. But before we get into that, it's helpful to learn a little bit about the anatomy of the eye. So here is a 3D model of your eye. This is the clear outer window of the eye called the cornea, and behind that is the iris, the colored part of your eye here. Behind that is your lens. Its job is like the lens of a camera. It helps to focus the picture you're seeing. It focuses the picture onto the retina. This is the inside layer of the eye, just like the film of the camera. The picture is then transmitted to your brain through the optic nerve here. And here is an example of what your lens looks like back when you were 20 years old, nice and clear and able to allow light to pass through. With time, your lens can become cloudy and hazy, making your vision blurry, and perhaps you will notice glare and halos around lights at night. This cloudy lens is the cataract. A cataract isn't a film that grows over your eyes, it isn't a problem with eye pressure, and it's not something that can be fixed with eye drops. In cataract surgery, we make a very small incision in the front part of your eye, the cornea, just a couple of millimeters. We break apart the cataract, your lens, and remove it from the eye. In its place, we put in a clear acrylic lens to help to focus the light for you. This will improve your vision by making what you're seeing more clear, with better contrast, more vibrant colors, and help to resolve the glare and halos that you're seeing. Next, let's discuss the different lens options that are available to you. Mind you, if you have diabetes or any other pre-existing eye issues like macular degeneration or glaucoma, please talk to your doctor about which lens may be best suited for you. Here we will show you videos that will simulate your vision when it's normal, with cataracts, and with each of the lens options. We will show 4 lens options here. Again, these options may not all be appropriate for your eye. On the sides of the video, you will see some icons that will provide more information. Let's first explain these icons. First is color and contrast. This shows how vibrant the colors are and how well the image pops in your vision. This can be thought of as the quality of your vision. Here's an example of good color and contrast. And here's an example of poor color and contrast, where the image looks very grayed out. Next is clarity, which is how sharp the image is. Here, the image is very sharp, and we're able to easily read the word Cypress Park in the top right corner in the distance. These icons to the right will indicate the distance that we're looking at, and will turn green to show how far we're looking. The tree indicates far in the distance. The book indicates an intermediate distance, about an extended arm's reach. And the phone indicates near vision, holding something near your face. Lastly, this icon will appear if the vision is with no glasses being worn, and this icon will appear when this is the vision with glasses on. Here's the vision of a healthy 20-year-old, great clarity, great color and contrast without glasses out in the distance. Now when we hold up a book at an intermediate distance, about arm's distance, the eye is able to easily adjust and make that nice and clear without glasses. Next we hold up a phone that's even closer than that, really close to the face, and the eye is able to adjust easily and make that nice and clear without any glasses. This is the ideal vision, something that we cannot achieve even with cataract surgery. This is the fountain of youth, which we do not have. This is the vision of a healthy 45-year-old without a cataract, nice and clear out in the distance, but when a book is held up close, things are a little blurry, but can be fixed with glasses like so. A little blurry. Again, the book is held up, a little blurry up close, but with glasses things can be nice and clear, great contrast, great clarity out in the distance. Now this is the vision of someone with cataracts. Even with glasses on, the vision is blurry at distance and up close. The colors are dimmed and yellowed, and contrast is diminished. Glare and halos with lights at night are present. This is the vision of someone without cataracts, At night, the lights are nice and clear without any glare and halos. The headlights are pinpoint lights without any circles around them. And here is a video of someone with cataracts. You see the glare and halos around the lights at night, which can be debilitating. Now this is option 1, the monofocal lens for the distance. This is the most common type of lens that is picked. This is for a patient who says, I want the best quality of vision. I don't want to wear glasses to see in the distance, things like driving, watching TV, or golfing, but I don't mind wearing glasses to see up close. This lens will return your vision back to when you're 45 years old. The distance will be nice and clear without glasses, wonderful clarity and contrast in color. And now, just like when you were 45, if a book is brought up close to your face, it will be blurry without glasses. Now we'll put a pair of glasses over your eyes like so, and it'll sharpen everything up. Glasses off, up close will be blurry, the distance will be clear like so. The book's coming back here. It's a little blurry without the glasses. And we'll slide the glasses back on, just like so, and that'll make the book up close really clear. So this is a wonderful option for the majority of people. There's no glare and halos at night. And these other lenses that we'll discuss are considered for patients in these specific situations. This is option 2, the monofocal lens set for near. This is for patients who say, I spend a majority of my time reading and I don't want to wear glasses to read, but I don't mind wearing glasses to see out in the distance for things like watching TV, walking around, or playing golf. This lens will make things blurry out in the distance, but when a book is brought up close to your eyes like this, it'll be nice and clear without glasses, with great clarity, color, and contrast. To see out in the distance, we can put a pair of glasses over your eyes like this, and it'll be really clear out in the distance. This is a great option for people who love to read, no glare and halos at night, with vibrant colors and contrast. This is option 3, the extended depth of focus lens. This is for a patient who says, I am willing to wear glasses to see up close, but I want to have a bit more clarity at arm's distance without glasses, even if it came with some drawbacks. Okay, let's see what that looks like. So out in the distance, nice and clear without glasses, good clarity, a little bit lower color and contrast compared to the monofocal option earlier. Now we'll bring a book out at arm's distance, a little bit blurry, but still able to make out some of the larger letters and words. Now the phone up close to your face, that's going to still be quite blurry without the glasses. So we'll reach for our reading glasses here. We'll put those on, just like so, and that should sharpen everything up. So this lens, you still need to put on reading glasses to see very clearly up close. Glasses off, and we'll show that book one more time. So we have that book coming up here at arm's reach, and that we can still see some of the larger words, and that's the benefit of this lens without glasses. This is option 4, the multifocal lens. This is the lens for patients who say, I really dislike glasses, and I want to do anything I can to not wear glasses for the distance and up close, even if it comes with a few more drawbacks. This lens gives you the best chance to be able to see the distance and up close without wearing glasses. The drawbacks are that some patients still find that they need to wear glasses to see up close. The quality of vision is not as good as any of the earlier options. Additionally, glare and halos at night with lights are more common and more noticeable than any of the prior options. Lastly, color and contrast are fair in bright light, but are diminished in low light. Let's see this lens in action. Out in the distance, nice and clear without the glasses on. And next up, we'll hold up a book at about arm's distance here, and we'll be able to make out those words without glasses. That's the benefit of this lens. It lets you see at these distances without putting on glasses here. Next up, we'll hold up a phone closer to our face, and still we're going to be able to read those words on the phone clearly without glasses. Again, out in the distance, nice and clear, but you'll notice a little bit diminished colors and contrast here compared to the other options. This again is an example of what glare and halos look like at night. You are likely to experience this with this type of lens. It is possible for these to decrease over time as your brain grows accustomed to it. However, this lens should be avoided if you are sensitive to this type of glare. Here is a picture to summarize the lens options. Thank you for your attention. Remember, any of these lens options are going to be an improvement from your vision with cataracts, so please direct any other questions to your doctor.